Good evening. My name is Jamie Gully. I serve as the president of SEIU Healthcare Minnesota and Iowa, a union of 50,000 healthcare workers across the two states, including thousands at Fairview Health and at Sanford Health. Welcome to our press conference, along with partners here today, in opposition to the proposed merger between Fairview and Sanford. This proposal came before the state 10 years ago. We opposed it then, and we oppose it again today. We are here today united in our opposition to this proposal in advance of tonight's hearing by Attorney General Keith Ellison, which will happen here just at 6 o'clock. We are opposed to this merger because it would transfer billions of dollars worth of charitable assets built up by Minnesotans to an out-of-state, unaccountable corporation. We are opposed. 10 years ago, we're opposed today. This merger would mean less options for consumers, lower wages for workers, more consolidation of power, and salaries for top executives at the expense of the consumers and the workers. Speaking today, we're going to introduce a couple of folks here today. First up is Erica Helling on behalf of the Minnesota Nurses Association. Erica?
Thank you. My name is Erica Helling. I'm an ICU nurse at Health Fairview Southdale. Deeply concerning for me as an Health Fairview nurse is the threat of a merger of our employer with Sanford Health. As a 25-year employee of Fairview, I'm alarmed that a Minnesota institution can be bought and sold to an out-of-state entity. This proposed merger is very personal to me, my employer, my hospital where both my children were born, my family's medical needs, and even cochlear implant surgeries for my child at the prestigious University of Minnesota Healthcare. Minnesota is known for its superior healthcare. Healthcare put Minnesota on the map. People travel from around the world to receive care here, care that every Minnesotan has come to expect. Nursing care elevates the patient's experience, provides vast improvements in our outcomes for those patients served in our state. Our nursing practice thrives in the state of Minnesota because of our nursing union. The Minnesota Nurses Association drives the standard of excellence throughout our state, ensuring that patients are cared for safely. Worrisome for me, as a union nurse, what happens when an employer buys out a system? Is our contract recognized? Do we need to fight all over again to keep the high standards and protections our contract provides to the practice of nursing and for patient care? As we settled our contract with Health Fairview this past December, the negotiating team attempted to bargain specific language that would provide some level of protection for our fiercely fought-for contract. Health Fairview refused to sign our preferred language, instead only agreeing to language that essentially states that Sanford must acknowledge our union. This is not protection. It likely would mean that we would have to renegotiate our entire contract. In recent years, Health Fairview has made significant changes in the landscape of healthcare here in the Twin Cities, buying Health East and then closing 2 hospitals within that system. The 2 hospitals had large significance in our community. Bethesda, one of 2 long-term care hospitals where patients with prolonged critical illness go to recover, and St. Joe's, a critical hospital in downtown St. Paul that served the underprivileged and mental health patients. Both shuttered hospitals were not money makers, but essential for our community's health. These examples of profit-driven decisions should alarm Minnesotans. A merger with Sanford Health and Health Fairview will not offer more. What's next on the closure list? What assurances do we have as Minnesotans that our quality care will remain? We all need to be aware and fight back against the next steps in the landscape changes in healthcare in Minnesota.
Thanks, Erica. Thank you. Can we real quick have you say and spell your first and last name for us?
Sure. Now?
Yeah.
Sorry. Erica, E-R-I-C-K-A, Helling, H-E-L-L-I-N-G.
Thank you, Erica. Let's hear it for Erica. Our next speaker is Cliff Adams, nursing support tech from Fairview as well. Cliff?
Hello and good evening, everyone. My name is Clifford Adams. I work at Health Fairview Masonic Pediatric Hospital and also serve as a grievance leader as part of SEIU. In the last 40 years, my coworkers and I have seen massive burnout, with over 40 nurses leaving just our unit alone. We have seen days where we have no linen, and I can't change a patient's sheet in a timely manner. We have seen days where staff has been assaulted, and weeks later, the employer finally decides to follow up and check in. We have seen a lack of accountability and responsibility when it comes to addressing racial equality and equity in the workplace. We have seen leading voices fall on deaf ears when requesting better training, safe staffing, and other union needs. In the last 4 years, we have seen our healthcare system strip away the caring aspect and monetize the health aspect. In the last 4 years, we have seen failure from our employer. We are struggling to tackle these major issues with a large home-based, Minnesota-oriented organization, and now we wish to combine with an out-of-state and equal disgruntled organization. Bigger does not always mean better. We need Attorney Keith Ellison and other branches of the government to help us deal with the problems in our own backyard first and foremost. We want the leaders on board currently in place to be held responsible so that the people who show up day in and day out, physicians, nurses, CNAs, nutrition services, ES, and all other support staff can have what's needed to foster a positive, effective, and caring environment for our patients. This merger will not serve the people of Minnesota. It will take away the power of choice from so many Minnesotans and add increased financial burden. SEIU stands here with all other unions in opposing the merger between Fairview and Sanford Health.
Thank you, Cliff. Do you need a spelling on the name? So, Cliff, you want to spell names as well?
Yes, CLIFFORDADAS.
Thank you. Let's hear it for Cliff. Our next speaker will be Bernie Burnham from the Minnesota AFL-CIO. Bernie.
Yeah. Good evening. My name is Bernie Burnham, and I am the president of the Minnesota AFL-CIO, the collective voice of Minnesota's unions. I am here because bringing in a for-profit corporation from a state with few regulations to run one of Minnesota's largest health providers is bad for countless people who depend on care from Fairview hospitals and clinics. I am here because we don't want an out-of-state corporation like Sanford trying to squeeze profits from the University of Minnesota's medical school. And I am here because Minnesota's entire labor movement stands in opposition to a merger that's bad for working people both inside and outside of the Fairview system. Our state government has an obligation to pursue lower healthcare costs, better outcomes for patients, better conditions for healthcare workers. This merger will do the exact opposite. As healthcare has become more consolidated year after year, the only people benefiting are the CEOs. Now, Minnesota's regulators have a chance to draw a line in the sand and tell these CEOs enough is enough. They have a chance to tell for-profit healthcare that Minnesotans aren't going to stand by idly while an out-of-state corporation tries to squeeze profits from workers and patients. We are committed to stopping this merger, and tonight they are going to hear from us. Thank you. Bernie, B-E-R-N-I-E, Burnham, B-U-R-N-H-A-M.
We will next hear from Gary Werdish from the Minnesota Farmers Union.
Good evening. I'm Gary Werdish, president of the Minnesota Farmers Union. Now, to give you relate to what we've seen in agriculture and farmers in rural communities have seen, we've experienced a lot of various mergers of various companies, whether we're buying our inputs from them or selling our outputs from them. We've seen with that, and a lot of times the promise has been, we'll be more efficient and we'll give you better services for all that. The vast majority of the time that is not true. But the worst part is, most of us, through all that various consolidation, we have seen what it's done to our rural communities. But the worst part is those profits do not end up in our local communities. Whoever ends up with the ultimate big guy that owns this particular company, the profits line their pockets. The mergers have always worked well for the corporate bottom line. They have not worked necessarily for the people that are supposed to be providing the services. And this particular one, healthcare, very concerning, because as the rural community, the more rural you are, the harder it is to have adequate health care because there's less population. And if you live, the farther you live away from a hospital, the more precarious your health care needs are. If you're farther away, time matters. If you're an hour away from a hospital, an hour away from an emergency EMT to get to you, that all matters. In this case, I could see Sanford wanting this, yeah. A South Dakota-based company, add to their bottom line, that works terrific for them. But does that work for the patients and the population of Minnesota? We don't believe so. We believe we were asking Attorney General to, glad he's doing these hearings, and ask him to close this merger for the benefit of the majority of Minnesotans. Fairview is a Minnesota-based company. The university with the research stuff they do there, it's Minnesota-based. We can't let go of that. We make a lot of talk about Minnesota proud, Minnesota grown, a lot of labels. We try and buy Minnesota grown products in our grocery stores. So I think we're all proud of being Minnesota proud. So I speak in opposition to this merger. And Gary, Gary, British, W-E-R-T-I-S-H. Thank you.
Thank you, Gary. Our next speaker will be Rose Roach, the Executive Director of the Minnesota Nurses Association, and then we'll answer questions. Come on up, Rose.
Thank you. Good evening, everyone. Rose Roach, Executive Director of the Minnesota Nurses Association, ROSE, ROACH. And we represent 22,000 nurses in Minnesota, Iowa, North Dakota, and Wisconsin. Many work in the Fairview and Sanford or Sanford system. The United States of America ranks 40th in the world for life expectancy, declining over the past 10 years. Declining life expectancy, yet health spending has increased by 87% from 2000 to 2019. Well, guess what? Those same past 10 years correlate with the growth of these large corporate healthcare systems. Paying more for less in healthcare, that translates into people's lives, literally lives. That's unacceptable. The impact of the merger mania has been underinvestment and abandonment of rural hospitals and services. Even worse, healthcare for minority populations, higher healthcare prices and insurance premiums, greater distance between decision makers and the people that are affected by the decision, and decreased autonomy of doctors, nurses, and patients. During 2021 and 2022, a frenzy of merger and acquisition activity resulted in more private equity involvement in healthcare. Studies show that healthcare mergers have caused a 41% increase in prices with no evidence of improved quality of care. What we need is public stewardship and oversight, wherein the hospital is accountable to us, the public, not these independent profit-making entities that focus on generating revenue. Hospital CEOs are on a quest to amass ever larger reserves through marketing campaigns and acquisition strategies to increase their market share and dominance. The problem is, these are business strategies, not community health strategies. The bottom line, we must stop this corporate takeover, return hospitals to serving as a community asset, and ultimately put patients before profits. Thank you. And with that, we open up questions.
Has M&A had conversations with Sanford about the contract issue of whether the contracts that were just reached will be honored?
Well, you heard Erica. I mean, no, not other than at the bargaining table. And they were told at the bargaining table they wouldn't give us the language we had proposed to ensure that the contract would follow, right, a successor owner of the facilities. So we are stuck wondering the same thing. Oh, they get to acknowledge the union. What does that mean? What does that mean? We don't know.
Have you heard from Sanford?
No.
I can tell you that I was part of the Fairview health system takeover. I was a nurse at Fairview at the University of Minnesota Medical Center in 1996, before, during, and after the Fairview takeover of University of Minnesota Medical Center. They made sure that the nurses at the University of Minnesota would not be covered by labor contracts when they took over the university. So,
Still just with
A&N-E, my name is a four-letter word.
Well, I mean, but they did that. They didn't do a straight contract. Yeah.
that study that was a 41% increase, what study are you referring to?
You know what, let me get back to you, because I just pulled it off of a report today, and I didn't write down the source, but I will get that for you. But that's a pretty common statistic that we are seeing, because this is happening all over the country, right? And so we're seeing that. There's been a lot of studies about trying to see, is this really something that is a benefit, both in cost containment and price, but also for patient care? And we're not seeing it do either of the things that they promised, as Gary said. Corporations have a different sort of focus.
There are several meetings scheduled, public input meetings. Are you guys planning to be at all of them?
Absolutely. Yes. Yes. Yep. We represent nurses in all of the areas where these look, and I believe SEIU also represents in most of those areas. The farmers obviously are spread out across the state as well. So we're working in coalition with a lot of different organizations and labor unions who do not see this as a benefit to them.
And I know you guys voiced a lot of concerns here this evening. Are these concerns similar to what took place 10 years ago, kind of the same situation?
I wasn't here 10 years ago, guys. I took a brief
Yeah.
run out to California, so go for it.
I was here 10 years ago, and yes, it's the same concerns. This is just a repeat of the same proposal, and with no new rationale. So nothing here for the patients, nothing for the workers, just for the bottom line.
Last month, Governor Walz expressed that he was more open to the idea now than a decade ago. Do you think he has any reason to be more open to that idea?
Well, wasn't present for Governor Walz's comments, but I would say that you see here labor and farmers united in opposition to this merger proposal from Fairview and Sanford.
Have the health systems been meeting with union members at all?
No.
I would like to add a comment yours regarding the nurses. I'm not sure if I'm saying it. Sandy Anderson, I'm an RN at St. John's. Previously at St. Joe's before they closed, SANDIE and ERSON. Oh, sure, thank you. We are also community members, and we partake in the care that we receive at these facilities. So as much as we work and we're concerned about our own livelihood, we also are concerned about our communities and our ability to receive the care that we need. And I can speak strongly to what happened in St. Paul and East Metro. When Fairview came in, I liken James Hereford's movement to a hostile takeover or corporate raider. He went ahead and downsized Bethesda. He got rid of that entity. St. Joe's might not have made money. We provided services. That ER was busy. We had a world-class cath lab. I mean, you'd be amazed at the ability of those cardiac surgeons to place innovative needs without having to crack a chest. It was amazing. That hospital was shut. Our emergency departments at St. John's and at Woodlands, United throughout the East Metro are overwhelmed. I have a friend who just had surgery at Woodlands. They were stationed off in a partitioned area off of the cafeteria with 5 other beds. There are no rooms. These were hospitals that had rooms. They had staff. Granted, COVID came in, but we provided care. And we do not need to create these deserts that Sanford will probably create throughout the state. And I look at the loss of hospice, the loss of home care, the loss of mental health beds, the loss of even the LTAC services. Our ICUs, we have patients in there now for 2 and 3 months because they do not have a bed to go to. Bethesda took patients from 5 states. I mean, there was a lot that they provided. So I'm very passionate about this because I'm 62. I've been a nurse for 42 years. I'm going to need something in the future. I'm sure. I want to be able to have that care done here locally in our area. So thank you.
One more question, and then we're going to go to the hearing. So if there's
This is just a clarifying question. I was just wondering, Sandy, is it with an I or a Y?
IE.
I
have to be different. SANDIE.
D-I-E, and then
Yeah.
Anderson
SON.
S-O-N. Okay, thank you.
If there are no other questions, we're going to go lift up our voices in the room with the Attorney General and oppose this merger. Thank you.